Have you heard of men using a needle and placing that into their penis in order to get an erection, and you think they're crazy? Well, they're not. It works. Let me tell you about it. Hey guys, Doc Heps here with UroCoach. So you've heard of guys who use an injection, draw up some medicine, place it into the penis, and they're able to get an erection. You're going, they're crazy, that's not for me. Well, stop there, because you may be just a candidate to do ICI or intracavernosal injection. We'll talk about how it's done, the reason why guys do it, some of the pitfalls, and at the end, make sure you stay tuned. I'll give you my tips to make injection therapy as easy as possible. Subscribe, like, comment. We love to hear from you. Let's get right into it. Why do guys do injection therapy? The main reason is Viagra and Cialis are not effective. Another reason is they may be on some medicines where they can't take Viagra or Cialis. Another reason is that the medicines may be effective, but they get awful side effects. It's usually mixed by a specialized pharmacy, and it's a combination of 3 different medicines. This includes papaverine, phentolamine, and prostaglandin. You inject these medicines into the corpora cavernosa. This is where all the blood vessels, the network of blood vessels, expand to create a good, effective erection. How is intracavernosal injection performed? The pharmacy will typically give you 3 things. They will give you a vial of medication, syringes, and they'll give you alcohol wipes. Number 1, you're going to wash your hands with soap and water. Number 2, make sure you have everything prepared. You're going to have your syringe, your vial of medicine, and your alcohol wipes. You hold the medicine upside down. You take the protective cover off of the needle. As this is upside down, you're going to place the needle into the rubber stopper and draw up the appropriate amount of medication. Once that's done, you can put the needle down in a clean place. You're going to access the penis. Here's a model of the penis. And so what you're going to do is you're going to put the penis on stretch. You're going to spread the skin out as thinly as possible. You want to avoid the bottom of the penis. You want to avoid the top of the penis. You're going to take the penis, put it on stretch in your left hand, and use your fingers to spread the skin as thin as possible. You're going to take the syringe like you would a dart, and you're going to take that and inject it at the mid shaft, not at the tip, not at the base. You're going to put the entire needle into the corpora of the penis. You're going to inject the medicine. Take the needle out and hold that area with your thumb or forefinger for about 10 to 20 seconds. In about 10 to 20 minutes, you should achieve an adequate erection. What are things to look out for? The main problem is having an erection that lasts too long. What I recommend my patients is if they have an erection that lasts for more than an hour, I tell them to take Sudafed. So when they pick this medicine up, I recommend that they get some Sudafed or pseudoephedrine from the pharmacy. That Sudafed counteracts the action of the medications that you're going to inject and shrinks the blood vessels back down. So if you have an erection that's lasting for an hour to an hour and a half, you should take 1 tablet of that Sudafed. If it doesn't go down within half an hour, take another tablet or a 3rd tablet every half hour. If it's still erect, make sure you call your urologist and they can help guide you. If you have an erection that lasts more than 4 to 6 hours, that blood can become trapped and cause ischemia, subsequently causing scar tissue and damage to the blood vessels, causing long-term erectile dysfunction. Other potential pitfalls are a low-grade swelling or bruising at the site of injection, and oftentimes your urologist can tell you how to properly inject and avoid that. Other times it just doesn't work and it's not as effective as you had hoped. Your urologist can increase the dose or adjust the concentration of the medicine to make it more effective. So here are my tips and tricks on how to perform injection therapy as safely as possible. Like I said, wash your hands. Make sure you have your 3 items ready: your syringe, your medicine, and your alcohol wipe. Make sure you turn the medicine upside down before you draw it up. This will help reduce the amount of air within the injection. Make sure you draw up the appropriate amount as prescribed by your doctor. If you see there's some air in there, you can adjust so that some of the medicine actually comes out of the syringe, a drop or two, and that will ensure that there's no air within your syringe. Put your penis on stretch. Make sure that you have an exposed area of the skin in the middle of the shaft, not at the tip, not at the base. Place the syringe all the way into the penis so you're ensuring that you're getting it into the corpora, not just the skin. Inject all the medicine and then pull out. Hold with your thumb for about 20 seconds. Make sure you have some Sudafed or pseudoephedrine on hand if that erection is lasting for too long. If you have any difficulties, just go see your urologist. He'll help guide you. We are very familiar with this process. Make sure you subscribe, like, comment. Thanks.